Anorectal disorders, it means that the diseases which are occurring in the region of anus or rectum. That's why they are termed as anorectal disorders. The number one disease which tops the list is hemorrhoids, or so-called as piles in the layman language, which is very common condition. And as we have already told that approximately 10 million people would be affected with this every year. And as per one study estimation, more than 50% of the US population over age 50 years have experienced hemorrhoids once in their life. So again, we have grades in the hemorrhoids. It may be 1, 2, 3, and as per some classifications, it is 4 also. The second common is anorectal fistula, and the third is anal fissure. Though anal fissure is much more common than hemorrhoids, but anal fissure is a disease which can resolve easily, whereas hemorrhoids needs little bit more efforts in with respect to management or in order to treat it. And then we have the rectal polyp or the anal polyp, so which can be a kind of carcinogenic kind of polyps. So even we need to excise them when it comes to polyp treatment. So basically, what I want to tell is, one is piles, then is fistula, anal fissure, and polyp. These are the 4 conditions which we usually see in our clinical practice. When it comes to the common clinical features or very evenly seen clinical features, then pain or burning sensation during defecation or just after defecation or 2 to 3 hours after defecation is one of the prime clinical feature with which, or the complaint with which the patient visits the clinic. And then this all happens due to constipation. Most of the times it happens due to constipation. Then sometimes there would be a mass per rectum, that is either it is outside itself or it comes out, pops out during defecation and goes inside. And then the discharge, wherein it can be pus discharge if it is anal fistula or anal fistulae. It can be mucoid discharge if it is hemorrhoids or even if it is anal fissure. Bleeding per rectum is also one of the very important clinical feature when it comes to anorectal disease, because if it is painless bleeding per rectum during defecation, then we usually go to piles as a provisional or the clinical diagnosis. If it is painful bleeding per rectum during defecation, then we go to anal fissure. And usually in the fistula, we see the soiling of undergarments with either pus, that is purulent soiling, or else sometimes it is mixed with the blood, but not exactly the bleeding that we don't appreciate or see in the anal fistula. Itching is also one of the symptom or the clinical feature because of the mucoid discharge which is seen in the piles. So sometimes there would be lots of itching also, which causes discomfort to the patient, and hence the patient runs to the clinic or the OPD immediately. For example, for an instance, I'll take a case of anal fissure. Anal fissure is nothing but a linear tear in the anal canal or at the verge of anus because of usually hard motions, that is usually constipated bowel. Sometimes it may be because of loose stools also and some other underlying diseases. Most of the times it is because of hard stools or constipated bowel. So what happens here is, it would be treated with little bit of analgesics, little bit of anesthetic gels and local application, and then the sitz bath. So if it is not resolving at this point of time, then definitely they opt for surgery. So they then just go ahead with surgery. When it comes to anal fistula or anal fistulae, which may be a primary or a secondary disease, or because of some underlying diseases also, like maybe tuberculosis or HIV, if it is multiple fistulae, then definitely most of the times we have surgery as an option in the contemporary science. Again, in the surgery we have lots of techniques. It may be a laser one, or it may be fistulotomy, fistulectomy, for fistula I'm talking about, or it may be plugging. So all these kinds of techniques we have in the fistula. But surgery is almost an option when a patient visits the OPD and is being diagnosed by fistula-in-ano. Of course, it is backed with some of the investigations like transrectal ultrasonography or endorectal sonography or MRI fistulogram. So after this, then definitely it's all about fistulotomy or fistulectomy. So it's all about cutting. But when it comes to hemorrhoids, we can still, in the contemporary science, it's still being treated with some of the medicines in the grade 1. Of course, diet and lifestyle changes are a must in all of the anorectal disorders. Corrections, it's required. And in the hemorrhoids, stage 1 till stage 2, then it's fine. Then if it has crossed stage 2, then definitely surgery is the only option which is left. And anal polyp, irrespective of anything, it's always good that we just excise it, we just remove it and send it for further investigations, maybe like biopsy or the histopathology. Definitely, because this is one of the therapy, or this is one of the field wherein Ayurveda has always topped the list, the treatment aspects. And here today I want to talk about Ksharasutra, because it is one of the hallmark of Ayurvedic surgery. And for those who feel that Ayurveda has no surgery, please note it down that Ayurveda has surgery. And so there is a master's and the doctorate in Ayurvedic surgery also. So it's definitely there. Of course, there would be restrictions for the surgery or the areas of the surgery wherein how general surgeon cannot operate for a neurological case, or he cannot become a neurosurgeon like that. Even Ayurvedic surgeons can also have some limitations, and then we'll be working in that limitation itself.